Hi, my name is Yvonne Garton. I'm the nurse care manager here at Carolina Advanced Health. I'd like to talk to you this morning about when it is time to call the doctor's office. We have approached the cold and flu season, as many of you are aware. Some of you watching actually may have woken up this morning feeling pretty lousy and are wondering, should I call the doctor, or is there something I can do here at home to take care of myself? So we'll go over some of the symptoms that would indicate that a call to the doctor will be necessary. So if you'll turn your attention to the slide presentation. General symptoms indicating a call to the doctor's office is necessary. A high fever greater than 102, especially if it's not responding to ibuprofen or Tylenol, which, by the way, you can take alternately. Tylenol is every 4 hours, ibuprofen every 6 hours, and you can alternate those. A fever less than 102 is not necessarily dangerous. It's an indication that your body's trying to fight off infection. So unless you're uncomfortable, leaving the fever to do its job is not such a bad idea either. However, if you also have fever with a rash or fever with neck pain and neck rigidity, that's something that you would want to call the doctor's office about. If you were feeling extreme fatigue, where it's, I can't even pick up my legs and my arms, confusion, seizures, persistent vomiting and or diarrhea lasting longer than 24 hours, it's not uncommon to have a stomach virus that makes you feel pretty lousy for about 24 hours. And it usually will last about that long. So if you're going longer than 24 hours, it's time to call and come in. You may be dehydrated. We want to avoid that. A very sore throat with high fever might be an indication of strep throat. A sore throat that's intermittent is probably not that much of an issue and probably related to sinus drainage. But if you have a sore throat that keeps you from even swallowing your own saliva, then that would be an indication, along with a high fever, that there's perhaps a strep infection going on. Night sweats are another thing that might indicate it's time to call the doctor. So respiratory symptoms specifically that require a call would be shortness of breath, wheezing, respiratory symptoms and sinus pain that last longer than 7 to 10 days. We expect a virus to last 7 to 10 days. If you're going past that point and not getting any relief or any improvement, then it may be a bacterial infection that we need to consider. Coughing that occurs in attacks where it's hard to stop coughing and or the cough makes a whooping sound. There's been a rise in pertussis over the last several years. Whooping cough is the other thing that, the other name that you may know it by. So, a nagging cough from sinus drainage is not concerning. A whooping cough or something that comes in like an attack would be concerning. So please remember, the common cold and the flu are viral infections. Antibiotics are not effective on viruses. They kill bacteria, they do not kill viruses. So when you get a cold, if you get the flu, an antibiotic is not actually going to make you feel better. The only thing that helps a cold or flu is time and rest. There's no magic pill to make a cold or flu go away any faster. You're going to expect to feel lousy about 10 to 24 days. A virus can nag at you for about 3 weeks or so. So if you're getting progressively better, then you're probably on your way to recovery. If you're not getting progressively better, if you're getting progressively worse, then we know we have a bigger thing going on and we need to see you and potentially run some lab tests or whatever. So in our office, we have dedicated appointments for those folks who wake up and say, oh my gosh, I feel terrible, I need to see the doctor. And so if you're ever in doubt, it's better just to go ahead and call for an appointment. Thanks and have a great day.